First speaker tonight is Dr. Lisa Katz. Lisa is Associate Professor of Internal Medicine and Equine Exercise Physiology in the School of Veterinary Medicine in UCD. She obtained her doctorate from the University of Georgia. She holds a Master of Science degree in Equine Exercise Physiology from Washington State University and a PhD degree in Equine Vascular Biology from the Royal Veterinary College in the UK. She's a diplomate of the American College of Veterinary Internal Medicine and the European College of Equine Internal Medicine, and she has over 40 refereed publications in the scientific and clinical veterinary literature and has made several contributions to book chapters in her specialist areas. Her clinical and research interests include equine laminitis, equine exercise physiology, and equine genomics. She obviously started when she was about 5 years of age with that amount of experience behind her. Ladies and gentlemen, give a warm welcome to Lisa Katz.
Thank you very much for that introduction. It's far too detailed, to be honest. Let me see if I move this out of the way. And thank you very much to Plusvital for asking me to come tonight to speak. Just again, very briefly, I'm not an equine geneticist. I'm a veterinarian. And so what I'm going to do tonight, hopefully, is give you a perspective from a veterinarian's point of view in terms of how I use genetics, how I learn from genetics, and how I think that genetics can really inform people in a lot of decisions, not just from a breeding perspective, but from a disease management perspective. And as a veterinarian, that's my key goal, is to actually try to prevent disease from occurring and certainly try to recognize risks for the disease and put in the appropriate treatment plan. So certainly, again, I'm going to actually give a very brief overview of how I use genetics and maybe give some examples of clinical scenarios, as well as where our research right now is taking us in order to try to achieve that goal in terms of trying to address ongoing diseases and traits that are not desirable from a health perspective as well as from a performance perspective. So I just thought it would be good to actually go through some terminology, because I am a very simple person and I try to keep things quite simple, and I get very confused very easily. Despite that introduction, I work very hard to try to stay up to date, and I find it very difficult sometimes. I think it's important to recognize that what we're looking at in terms of genetics is a lot of different input in terms of how a trait or traits are expressed. And that from my point of view, when I'm looking at genetic testing, the things that I'm really interested in looking at is the genes which would occur in pairs, whether you have a mutation that is recognized, whether it's something we call as dominant or a recessive, which means that you need to have one or two for that undesirable trait to actually be shown, and whether the gene itself, or I should say the disease itself, is simple or complex. In other words, does it require just one genetic or one mutation in the gene, or do you need to have a lot of different inputs from different genes for that trait to be expressed? And certainly when we think about not just expression of a disease, but also a carrier. So from a breeding perspective, a lot of times if you can recognize carriers in advance, you can maybe minimize an undesirable trait or a disease from actually being shown. So certainly, not just looking for the disease itself, but whether the animal carries that trait is very important. Heritability is something else I think is important to consider, and we all know when we look at certain diseases that are more likely to show up in certain breeds or certain lines, that you've recognized already that there are traits that are inherited. I think that when you are looking at having more concrete information, that can actually take some of the guesswork and bring it forward a bit in terms of you've got more concrete objective information that you can use to make decisions. And the term phenotype is just something that I learned, and you will actually see or hear people talk about. That's the physical characteristics. So you've got the genetic blueprint, but what the actual presentation of a horse's trait in terms of their health or how they respond to a stimulus such as training, that is going to be characterized and expressed in terms of a physical manifestation. So certainly when we're looking at a horse that is a superstar, there's a lot of different things that are inputted into how that actually is achieved. There's a whole range of diseases in which genetic mutations, so a change in how the gene is expressed, have been found in certainly in horses, and I'm not going to go through all the specific things. Certainly, I think that when you look at diseases with no mutations, there are genetic tests then based on these known mutations, which actually give you an indication, not again of just is the disease there, but also risk. So from my perspective, there's some diseases in which if you put the horse in a certain environment, it enhances the presentation of that undesirable characteristic. And if you know the risk, you can modify that environment so you can actually minimize and even take away that physical presentation. And I was going to actually go through an example of a disease in which identifying the genetic mutation and having a test has really enhanced not just the welfare of the animal, but the usability of the animal. So one of these diseases, and again, because I chose this because there is a genetic test, but also because I think that it's something that you see with a certain amount of frequency here in Ireland. It's not a thoroughbred, but it actually is a disease that's very similar to something you see in thoroughbreds. So this is polysaccharide storage myopathy, or PSSM. And it's something that you predominantly see in the heavier breed animals. So the quarter horses or quarter horse related breeds, or your draft or draft cross, your warm bloods. And it is a genetic disease in which you only need to have one problem with the pair of genes to have that trait sort of seen. So it's a dominant expression. So that means that if you look at that here, that you can have one normal and then one mutation, and you will have an affected animal. Okay, so basically it doesn't require two abnormalities for that trait to be expressed, it just requires one. The presentation of this disease is very much similar to something that we see in thoroughbreds, or predominantly in thoroughbred-related breeds, which is your recurrent exertional rhabdomyolysis. So basically, this is a muscle disease in which the animal starts to tie up in response to exercise, a stimulus. The whole variety of presentations of this disease certainly depend on the stimulus. And it can be something in which the animal has quite vague signs all the way up to where it has very bad episodes of tying up, just like you would see with a thoroughbred. The thing about this disease versus the tying up you see in thoroughbreds is you don't need to have the same level of exercise to have that expression. So very low intensity exercise, so even just walking or trotting can cause an animal to significantly tie up. And it's something that's certainly associated with a lack of regular exercise. So, an animal that is a weekend warrior kind of animal, for example, where it doesn't do too much during the week, and you take them out for, a good spin on a Saturday or a Sunday, certainly would be more prone to these problems. And the problem is that there's an excessive storage of sugar. So these are really, you look at the easy keepers, and this would be something you think about. So basically, the sugar is in the form of the glycogen or the polysaccharide, so hence the name polysaccharide storage myopathy. So myopathy is just a muscle disease, and there is a genetic test. So there was a mutation that was identified, so there's a genetic test for type 1, and most of the horses that express the tying up will be identified using this genetic test. So basically, the other thing that I think about in terms of using genetics is that it reduces the amount of invasive procedures I have to do to the animal to come to my conclusion that this is the problem with the animal. So basically, before this genetic test, what we would have to do is take muscle biopsies from these horses. We'd have to actually take a slice of the muscle and send it off, and we still do that to confirm things. But it's much easier now if we just take a blood sample and send it to the lab. And it comes back as, whether this horse has this genetic mutation or not. And given that most of the cases will be identified with this, it's a pretty good way to test for this disease. The reason I think it's good to know about this is because this disease can be managed with both diet and exercise. So you can have a horse that has this mutation that is actually very, very normal to use if you manage it appropriately. So the whole thing is that if you could identify an animal that, based on how it looks or based on the type of breed that you really should test, you can actually minimize this disease from ever becoming apparent if you can control the environment. So the exercise needs to be a continuous, not a sort of every 2 week kind of thing. And the diet needs to be more of a high fat. So less grain in terms of the carbohydrates, more fat. And certainly we think about sugars found in a lot of other things. So certainly one of the things we see here in Ireland as the grass is very, very rich, very, very full of sugar. And so these are the kind of horses that maybe you need to minimize that kind of exposure to that really carbohydrate-rich type of grass. So the second disease I wanted to talk about is this is a disease in which there is no currently genetic test, but there is a lot of research looking into identifying a genetic test. And again, this is something in which phenotype, you can look at the animal and you can say this guy has a risk for this. So this is called Equine Metabolic Syndrome, or EMS, and it's a disease in which the horses would have either a generalized amount of obesity or regionalized areas of obesity. So they'd have abnormal fat deposition along their back, along their neck, a very crusty neck, things like that. They also would have what's called insulin resistance. So basically this disease is very similar to the type 2 diabetes you see in humans. Right? So basically these animals are the easy keepers. And there are certain breeds, again, in which there's a risk for this disease to show up. And certain individuals. So it doesn't mean that if you have an animal that's not a Pasture or Morgan, but it's a really easy keeper in that, it doesn't need to do more than look at a blade of grass and it gains weight. Like I feel like sometimes I'm an easy keeper, So basically you have these easy keeper animals that it would be great if you could identify with a simple genetic test that this animal is certainly at risk for developing, further clinical signs associated with this disease, because the big thing that we're worried about is the laminitis, okay? So basically, it's one thing to have a fat horse, sorry, I shouldn't say fat, people get a little upset. So an easy keeper kind of horse, a horse that doesn't require a lot of input, but it's another thing to try to treat a horse that now has developed laminitis. Because once they've developed that, it's something in which they're increased risk for redeveloping, and it's very, very difficult to actually maintain these animals pain-free depending on how severe the problem is. So what we're looking at is we want to actually identify these horses before this starts. And certainly, again, given Ireland and the amount of lush green grass, there are a lot of laminitis cases here. And one of the things we see is what's called pasture-associated laminitis. We have these horses go out in the grass and they actually founder. And it's thought that maybe these kind of cases would be early forms of this disease. So if you know this in advance, you can modify this animal's environment so it doesn't get to the point where that animal is showing or developing your laminitis. And that's the whole key. That's how I look at using genetics, as an information to help me not just choose the correct horse for a given performance, but how to keep the animal healthy, how to keep the animal from developing injuries or diseases in which it's going to be not just more costly to deal with, but actually have a poor prognosis for that animal to return to the previous level of health and soundness, and to be used for the, whatever intention that you have for that animal. So if I look then at diseases of the equine athlete, and I take that information or the way that I use genetics and apply it towards performance animals, you have to remember there are certain things, I think, when you have an animal in a more high-intensity kind of exercise environment in which you see certain risks for problems. And again, as a veterinarian, I want to reduce those risks from becoming real. I want to actually keep the animal healthy. I want to keep the animal injury-free. I want to keep the animal disease-free. And if I know that if I put it in a certain environment that increases the risk of certain animals based on the genetic blueprint from developing these diseases, that's my goal. So it's not just trying to enhance the performance, which again, I think, that's certainly what I want to do, but I want to do it in a way that keeps the animal healthy. So I want to actually be able to make these decisions based on the overall welfare of the animal. So when we look at areas in the equine athlete that you see problems, certainly the musculoskeletal system is going to be the primary place where you see any kind of reason for poor performance. Most of the animals that present with poor performance have something going on in the musculoskeletal system. And the high-intensity animals, the racing animals, that's going to be the tendons, the joints, ligaments, and certainly to a certain degree the muscle. The second most common place is going to be the respiratory tract, okay? And that includes upper and lower. And most horses actually have more than one problem going on. The way I actually approach things, I like to use evidence to base my decisions on. And I think knowledge can actually make it more complicated, I agree. It used to be very simple. If you just looked at something and you didn't know anything else around that, you made your decision. But I also think that if you have more knowledge and you can use it in a very systematic way, it can really actually become quite simple if you just try to keep some of the noise around, down. So certainly when I think about the respiratory tract and poor performance, I look at the literature and I look at the research that people have done. And so two relatively recent papers, certainly looking at different types of horses. So one was looking at standardbreds and one was looking at endurance horses, so racing and endurance. Found in both groups of animals that the upper respiratory tract certainly was very commonly affected, and everyone thinks about that. It's easier to actually hear an abnormal noise or to maybe have an animal have a camera placed up the nose so you can see it. But interestingly, most of these horses, or a large percentage of these horses, also had problems in the lower airway. That's an area in which it's a little bit more difficult to see abnormalities clinically, other than they don't perform well. You've got to go investigate. And when I say investigate, sometimes you have to do slightly more invasive things. You've got to actually maybe stick a tube down into the animal's lungs and do a lung wash. So from my perspective, when I'm thinking about these diseases, is there a way that I can actually, A, identify animals early on in their training and their racing that might be at risk for developing these problems, and B, can identify the animals that would benefit from slightly more invasive procedures rather than subjecting horses to some of these procedures that maybe they don't need because it's unlikely that's going to be an issue. So just looking at the upper respiratory tract, everyone thinks about roar or, palate problem, and certainly those would be very common abnormalities, but there's a whole bunch of things. And I put all these pictures up there just to sort of identify or show anybody, visually the variety of different ways that you can have problems in the upper airway tract. The thing that we are looking at in our research group is RLN, the recurrent laryngeal neuropathy. And that's really largely based on previous studies that have shown that there's likely to be a very strong inherited component to this disease, and it's something that we potentially could find mutations in which we can maybe put together a test to evaluate for the likelihood that this is going to be a problem. So what we're looking at here, just for people who are unfamiliar in looking at upper airway scope pictures is, let's see if this is coming up. So this is the opening to the trachea here. So that's the windpipe, okay? And that is the epiglottis, and underneath that is the soft palate. You put your tongue up to the roof of your mouth, you can feel the hard palate. Behind that is the soft palate. A horse has a very long soft palate, which means that they're what we call obligate nasal breathers. They can only breathe in and out through their nose. They don't breathe in through their mouth. So any little reduction in the diameter or the opening of the airway really makes it much harder for them to bring air in and out. And this is where the noise is created. Interestingly, a lot of horses, and certainly when we look at RLN, for example, 50% of horses that have this disease don't make a noise. So you have to actually look for it. So this is the opening to the trachea there, and the opening to the esophagus is actually right above that. And these are called the arytenoids. So these are cartilages. So you can feel your tracheal ring, so that's cartilage. So basically, there's muscle there that actually allows the cartilage to open up. So during exercise or excitation, these things open up and the opening to the trachea becomes bigger. And when we look at animals that have this disease, such as in this picture here, they have problems actually adducting or opening up these rings. So in this horse, we're looking straight at the larynx. This is the left side here, and this is the right side, so this is not abducted properly. Okay, common lower airway disease, certainly there aren't that many versus the upper airway, but you got to look for them. And the main thing that I'm interested in, certainly a lot of people in the racing industry would certainly be aware of, is what's called inflammatory airway disease. So it's a lower airway disease in which there's a lot of inflammation, and it results in problems in oxygen getting into the blood. The interesting thing is that when you look at these diseases here, these 3 diseases, so this is the horses that bleed, EIPH, and this is your heaves, all right, up here, the recurrent airway obstruction. They all have a genetic component. So basically, these are all diseases that potentially a genetic test could be developed to identify these animals. But it's not as easy as that, or everyone would have already done it by now. So it's all about trying to accurately characterize the physical trait. If it's a simple gene, a simple trait, it's something I think a little bit easier than these complex traits. And when we look at animals that are performance animals, certainly the responses to the stimuli, such as exercise and training, this requires a lot of different input for a lot of different genes. So it's a complex trait. So you need to actually be able to identify the physical characteristics quite closely. And the other thing to consider is that you've got to do it, or at least the way that we've been doing it, you've got to do it in the environment in which the animal is asked to exercise and exist. So basically not in a lab, but actually out in the racing yard. And so that means it's very, very difficult to actually control for variables that might impact on how that physical presentation occurs. So I just wanted to show you how we've tried to address that. And I think it's something to consider when you are looking at other genetic presentations that people talk about. Have they actually characterized these traits well enough to actually say that what we're looking at in terms of the genetic evaluation is actually creating that trait? So what we were looking at in our research group was that we could see variation in genes resulting in abnormalities in a trait leading to poor performance. And we specifically wanted to look at the airway. So we knew, or we certainly knew from the literature anyway, that it was likely to be a complex trait, and then we needed to try to characterize this as well as possible. And as I said before, the ability to characterize this really is very important, because otherwise you need thousands and thousands and thousands and thousands of animals, which is not something that's going to be realistic. And you'd be having to wait years and years and years and years for something potentially to be developed. So we were lucky enough to do some evaluation in a single training yard, and what we did is we tried to obviously minimize any disruption to what the animals normally do. We mapped everything in terms of the distance and the incline. We tried to standardize when we were evaluating the animals in terms of when they were exercising, so only on sprint days, for example. We tried to look at their training status and standardize that so that anything that we saw wasn't actually changed because they were at a different level of training, for example. And we recorded everything that we could to try to minimize any variation that might be contributing towards alterations in that physical trait that we were looking at. We looked at field-based equipment, so we have used GPS, and I think that a lot of people here would be familiar with that. It's just the same GPS as you use to try to find your way to the hotel tonight if you're like me. So basically, it was to track where the horse was and what they were doing, and we look at that in combination with a heart rate monitor. So we look at the speed and heart rate associations, and then we were lucky enough to actually have an overland scope right here. So we can actually look at the upper airway. We could look at the function of the larynx while the horse was being ridden. And this is something that has becoming more widely available for people to do, not just from a research point of view, but certainly from a clinical perspective. So traditionally, we've always had to use the treadmill to evaluate the upper airway. If the horse had a poor performance issue, was making a noise, we had the horse come into the clinic, and we actually had to train them up, acclimate them to the treadmill, and then try to replicate the workload that they were doing when the problem actually was identified. And it's very difficult to do that. And to be honest, I think it's now recognized by a lot of people that what you see on a treadmill cannot be replicated out in the field. And so we now have been using this overland scope. Let's see if this video works here. Yeah. Okay. And these horses tolerate it really, really well. And it's a really, really good way to actually identify what's going on in the upper airway when they're doing the job that you're asking them to do when that problem is identified. And so it's not something, again, just from a research point of view, it's something clinically that as veterinarians, we would actually use quite frequently. So just giving, understanding that basis, looking at the project where we're looking at RLN. The reason, again, that we're interested in looking at this, because it is something that we've identified to be performance limiting, and certainly the research in the previous research in the literature before would support that. It's something in which there's a genetic component very likely based on, again, previous work. What we're looking at here, this is a still, just again to show everyone, this is the opening to the trachea, which is obscured in this horse, okay? So this is the left arytenoid, this is the right arytenoid. We're looking at the epiglottis and that soft palate. And you can see the opening to the trachea is reduced in that scenario by, I'd say 60, 70%. And you have to remember, when you're looking at horses' airways at rest, they can be quite normal at rest. You've got to look at them when they're being ridden or when they're exercising to really identify for normal versus abnormal responses to that stimulus. And the other thing is that horses, they're elite athletes versus other species for a reason. And one of the things is their respiratory system. And they can actually achieve very high respiratory rates, about 120 to 140 breaths per minute. So you've got to actually not only look at this when the horse is exercising, but you've got to record it and go back and look at it frame by frame by frame to identify something like this. So doing this, certainly, I think, is a semi-invasive procedure. It's something in which you've got to actually stick a camera up the horse's nose and actually ask it to go out and do some exercise. And certainly if you identify a problem like RLN, the way you would treat it would be surgical intervention. So from my perspective, I want to actually maybe try to identify the horses that would be at more risk for this disease before I just start randomly, scoping horses to look for the presence. Because as I said, up to 50% of the horses with RLN won't actually have a noise. And so just to show you, this is the speed at which this recording was made. So about 28 miles per hour. Okay, so you can see it's opening, okay, and there you can see it's closing there, okay? And this is this frame has been slowed down. It's been slowed down quite a bit so that you can actually see the impact that might have on diameter. So basically, the smaller the diameter, the increased resistance to flow, the harder it is to get that air in and out. So it makes it a quite performance-limiting problem. So we thought that we could identify genetic variation in horses that were normal versus horses that had the disease, that we could maybe use these as markers for a risk for a genetic test. And we wanted to try to look at different environmental factors that might affect our diagnosis. We wanted to make sure that what we were saying was a disease was truly a disease. And so what we found to date, and certainly we're still looking at some of the information, is that we could actually identify and grade. So grade is just talking about the severity of the disease presentation. So we could identify and look at the severity pretty consistently and pretty repeatability, with good repeatability. And we can actually have different people evaluating this with pretty consistent findings. So it didn't matter whether you had 2 or 3 or 4 different vets looking at this. We were pretty consistent. There was an association with height, which I think a lot of people were aware of, and we confirmed that. And we have identified some markers that we think have very strong potential for developing a test. And so it's something that we are actually still pursuing and thinking that it's something that could become potentially available at some point. The other reason I think it's important to consider is that this disease is or has been spoken about as a progressive disease. So basically what we're looking at is this is the same horse. So this is a horse when it's about 26 months of age, 37 and 41 months of age. This is the same exercise bout, so going out for a sprint exercise bout. You can see very normal abduction there. So there's that left and right arytenoid open up quite well. And then you start to see a little bit of a fall off there and there. This horse has now got more than just RLN. It's got other issues going on there, but this is something in which it's progressed over time. So if I, scope the horse right here and I said, okay, done with it, then it's something in which I may not have been able to identify, in that horse until it was quite progressed down the line. So I just wanted to summarize, this talk in that I think in any way, prevention is key. And so from a veterinarian's point of view, I think having enough knowledge to prevent the disease or the injury from occurring is the key. So I think genetic testing, certainly from, again, my perspective, so my opinion, and I do actually firmly recognize that this is my opinion, but I think a lot of people would hopefully agree with me, is that if you have enough information, you can actually make the appropriate management decisions, the appropriate breeding decisions, certainly the appropriate environmental decisions to minimize a disease from either becoming worse or from showing up. And so I think that from a genetic point of view, information is power. And I tell the students this all the time. Certainly, I think the more knowledge you have, the more informed you are, the better decisions you make. And really it comes down to economics. If you want to look at it from that point of view, I think economics will be advanced with that kind of knowledge. So thank you very much.